Nursing scope of practice. The influence that an expanded nursing practice can have on healthcare and the community are limitless. Decreasing healthcare costs would be an easily identifiable benefit: less physician interaction, less cost to the system and the patient. Studies that I will present have shown an increase in patient satisfaction when there has been an increase in patient interaction by the nurse with their expanded role. The studies have also shown that with some expanded nursing roles, there is a decrease in the length of hospital stay for the patient versus interaction with the nurse in a non-expanded role. Additionally, there have been programs instituted that have been able to evaluate, treat, and release patients in a home healthcare setting with physician consultation as needed, decreasing the need for the physician to be seen within the health system.